Hi, I'm Dr. Adair Look, and I am a psychiatrist in Northern California and a friend of Professor Dunkel's. And she asked me to speak to you all on eating disorders, which is the specialty that I treat in my practice in Santa Rosa, California. My training to teach eating disorders is that I went to medical school in North Carolina, and then I did my residency at Mass General Hospital and McLean Hospitals in Boston, Massachusetts. And in my third year of residency, psychiatry is a 4-year residency, so in my third year of residency, I worked with the Harvard Eating Disorder group, which treats people with eating disorders all over the world. And I did research there, and then I worked in the student health department, seeing the patients with eating disorders at Harvard University undergraduate and graduate levels. And then I moved to California and ran the women's health department in the Department of Psychiatry at Cal Pacific Medical Center, and then opened a private practice in Santa Rosa, which is about an hour north of San Francisco. So the reason that I think that it's so important to learn about eating disorders and to study them is that they are the #1 killer of any psychiatric illness in the world today. So ahead of depression and ahead of schizophrenia. And they're not ones we talk about that much, I think in part because it's mostly women that get them. But a half to 1% of women in the world have anorexia, and 1 to 2% of women in the world have bulimia. And anorexia, of the women who get anorexia, 20% will die of that disease. So that's a huge, huge number of people that have these illnesses. And we don't really know how people get eating disorders. And there's a lot of practitioners out in the world who will tell you that they know, and they'll have this kind of treatment or that kind of treatment. But as far as research goes, we don't know how women and men, but women especially, get eating disorders. What we do know is that there is a lot of involvement in the media as far as telling women what they should look like and how their body should be shaped and how much they should weigh. And the most profound research showing that was done in Fiji in the early 90s by a woman named Ann Becker, who's one of the leading researchers in eating disorders in the world. And she does her research out of Harvard. And she went to Fiji right before the media was introduced to the Fijian people. And she studied bulimia in the population and found almost no bulimia at all. And in fact, when women at that time, if you talked about somebody's daughter or sister, if she was saying something really terrible would happen to them, you'd say that they were going thin, which means that they were losing weight. And that meant that people didn't love them, because if you were really loved, you had a big round body because you were well fed. And that was what the ideal was in Fiji all the way until the early 90s, when television came to Fiji. And within 3 years, the incidence of bulimia was that of the Western world. In Fiji, it's heartbreaking. And so we know that the media plays a huge role in telling women how how they should look, and in having people get eating disorders. We also know that it's genetic, and that it definitely runs in families, and it's considered sort of an anxiety disorder. It's sort of along that spectrum. And so certainly people who have anxiety disorders, especially eating disorders, their offspring are more likely to have that kind of an issue. So it's both nature and nurture, and something we don't know enough about, but we continue to research all the time. So the way that I treat these patients in my practice is that I think about it as a 4-pronged approach, which is that there's a psychiatrist involved giving medications, there's a therapist involved doing weekly therapy, a nutritionist who helps people sort of figure out what to eat and how to eat, and then a primary care doctor making sure people's blood levels and that kind of stuff is okay, checking their weights. Some psychiatrists do therapy as well, like me, and so I'll often be the therapist and the psychiatrist, or do the medications and the therapy, so there'll be only 3 of us, but usually there's 4. There aren't actually any medications to treat eating disorders, but oftentimes you have to treat other psychiatric disorders that are concurrent with the eating disorder, like depression or anxiety. So it's important to have this group of practitioners supporting the patient, because it takes a lot of different heads to sort of put together to support these patients, because it's very tough to treat them, but also because the disease makes people very sneaky. And in order to get away with sustaining an illness like anorexia or bulimia, you have to be sneaky about when you eat and how you eat, when you vomit, how you exercise, when people haven't told you to. And so you need a lot of eyes on you to make sure that you're not getting away with too much. And so that's also the reason there's a group treating. So the psychiatrist is usually the head of that team, and that's my job. And I love it, and I think it's really rewarding. But I think that there's a lot that everybody can do every day to combat eating disorders by doing things like Body Positive, which is a program in Northern California. They're all over the world, and many, many in the U.S. That people can get involved in to support women and to make to sort of put away with the stereotypes that women have to be a certain way and look a certain way and weigh a certain amount. So I think that's all I have to say on eating disorders.